Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, January the 27th, 2021. It is week 47 here in Montgomery County of the pandemic, and today is our 100th press briefing. Hard to believe, 100th press briefing since March the 8th. And today I'm joined by my colleague, Commissioner Ken Lawrence. So I have some very serious news to report this afternoon. Today we are reporting the first documented Montgomery County case of the UK coronavirus variant. The patient is a 30-year-old individual. The individual started having symptoms on January the 13th, 2021. The symptoms included fever, muscle pain, fatigue, headache, sore throat, stuffy nose, cough, loss of taste and smell, abdominal pain, and diarrhea. The individual tested positive on January the 15th. The Office of Public Health was notified on January the 17th of the positive test result through the PA-NEDS system. The Office of Public Health was then notified by the Pennsylvania Department of Health of confirmation of the B117, also known as the UK variant, on January the 24th. The Office of Public Health completed contact tracing on January the 25th by the next day. The individual is a bartender at a bar and restaurant, which was reported by the individual to have had multiple cases of COVID in staff members going back to last November of 2020. The individual worked a double shift the day prior to the start of symptoms. The individual has no travel history. So this is just a reminder that it is quite likely that this more contagious UK variant is here in Montgomery County. And if you needed another reminder to be careful in terms of wearing a mask, keeping your hands clean, and watching your distance from others, this is certainly the wake-up call to do so. I'll move on now to our latest vaccine updates for Montgomery County. The vaccine situation is changing on a daily basis, and I want to continue to ask our community's patience and understanding during this evolving situation. The Pennsylvania Department of Health changes to the vaccine eligibility announced last week dramatically expanded the eligible group of recipients in the 1A group. However, there has been no comparable increase in the amount of vaccine that the Montgomery County Office of Public Health is receiving. In fact, this week we received 500 fewer doses than we did last week. As a reminder, the expanded 1A group includes people ages 65 and older, and people ages 16 to 64 with specific underlying medical conditions that are known to be associated with severe cases of COVID-19. Montgomery County Office of Public Health receives its vaccine from the Pennsylvania Department of Health, and thus we are required to comply with the newly released guidelines for 1A. With these expanded definitions for the 1A group, we estimate approximately 230 to 250,000 additional people qualify for vaccination in Montgomery County as part of Phase 1A. We continue to implore the Pennsylvania Department of Health and the federal government to consider allocating vaccine according to population demographics, meaning that we want them to take into account how many people live in this county who are over age 65 and estimates of how many people that are under 65 have one of those specific underlying conditions. That would go a long way to helping us meet the demand here in Montgomery County. We have the infrastructure in place. We just need more vaccine. For now, anyone 65 and older or those aged 16 to 64 with, 18 to 64 with specific underlying medical conditions are encouraged to pre-register to receive the vaccine on our website at montcopa.org/COVID-19. And at the top of that page is a green button that says Vaccine Information. Click on that, and that will take you to the page that has all the details that you need. If you have already pre-registered on our site, You don't have to do anything. We have you in the system. Even if you registered when there was still the breakdown between 1B and 1C. If you were eligible for this expanded 1A group, you've been moved into that group and you did not lose your place in the line. As of 9:30 this morning, we have 121,510 people pre-registered in our system. At this time, depending upon when you registered, it may take 6 to 10 weeks before you hear back from us about scheduling an appointment. I've been asked why the county is only making appointments for a few days at a time, when other places are making appointments for many weeks into the future. We do this because we do not have any certainty about how much vaccine we are going to receive each week until the vaccine actually arrives. This week was a perfect example. We were told on Monday we were going to get one amount of doses, and then we were told yesterday that we were getting a much lower amount. If you receive an appointment through the county, barring some catastrophe, we will have a dose of vaccine for you. We just don't want to have to cancel anyone's appointment. We've also been asked whether or not we can tell someone who is pre-registered where they are in the line. We're working to put information on our website that would give you a general idea of how many people are ahead of you based on the date that you pre-registered with us. So I can tell you, for instance, right now, that if you registered on one of the first day or two that we opened, you should start to be receiving an appointment for a vaccination within the next week to 10 days. And then, of course, it will go from there. I want to remind everyone that wherever you receive your first dose of vaccine, that is where you need to go to get your second dose. So for individuals that have gone to pharmacies or health systems in other counties or in other states, you must plan to return there for your second dose. We won't have a second dose for you. I also want to remind people and ask you to please not forward appointment links that come to you to any family or friends. If you receive an appointment link, that link is only meant for you. It's based on your eligibility and if it is your first or second dose. Because of the scarcity of the vaccine, if you forward that link to someone who's not eligible, they will be turned away at the vaccination site if they're not in the eligible group. It's hard to believe, but we opened the Montgomery County Community College mass vaccination site on Wednesday, January the 6th. These 3 weeks have gone by so quickly. Starting next Wednesday, February the 3rd, the Montgomery County Community College will only be open to individuals returning for their second dose. So next Wednesday will be the beginning of that 28 days since the first dose. And since we're using the Moderna vaccine, that's the interval. So the community college will be open to only people who've been there before and are getting their second dose. At the same time, next Wednesday, we will open a new mass vaccination site at the Norristown High School. Go Eagles. I want to thank them so much for their help with this. So the site at the Norristown High School will be for first doses only. Any first dose appointments beginning on February the 3rd will be for the Norristown High School site. Individuals cannot choose their location since each location is tied to whether it is your first or second dose. I want to thank the Norristown Area School Board, led by President Shay Ash, and Norristown Area School District Superintendent Christopher Dormer for their support and partnership in making the high school available for this really important effort. I remain very encouraged by the enthusiasm that so many people have in our community to be vaccinated, and I continue to ask for your patience. I want to share with you this week's graphic, again, to give you a sense on where we are in this process. So, the County Health Department has received, as of this morning, actually, 21,500 doses. That's what the Office of Public Health has received. We have administered 15,677 doses, so that leaves us with 5,823 remaining. However, I want to point out that of that 5,823, we received 4,500 of them this morning. So you can see how tightly we are scheduling these appointments. If we hadn't gotten our doses today, if they hadn't arrived today for some reason, we would have had to cancel tomorrow's clinic. So I just want to reassure everybody that that 5,823 number is so big because 4,500 of those doses arrived today, this morning. We continue to give 1,000 doses a day, often somewhat more than that. So as has been typical for us, we have just 5 days till our next shipment. And if you do the math on this, that's about how many days worth of vaccine that we have left. So we are getting this out the door as quickly as possible. This is part of the case that I'm trying to make to PADOH and others, that we are ready and able to give a lot more vaccine than we're getting, and hope that we will start to get more vaccine. So in terms of who's remaining in 1A, we know from, of course, the census that we have 151,031 people that are 65 and older. We have estimated, and this is a rough calculation, but we've estimated about 100,000 people who are between age 18 and 64 with high-risk conditions. And we have left about 5,000 to 6,000 healthcare personnel that were part of that original 1A cohort. So we have a ways to go here before we are done with 1A. And just to give you a sense, as a reminder, we have about 830,000 people here in the county. According to the state's Department of Health website, there have now been 35,234 Montgomery County residents that have been partially covered, and that means they've received one dose. And of course, this includes not just the doses the county has given, but our hospital partners and a few pharmacies. And then there are 8,683 who've received both doses. So we're making progress, but we can make a lot faster progress if we have more vaccine. In the meantime, we encourage those that are eligible to pre-register now so that you can be notified as soon as additional appointments become available. Appointments are required to receive the vaccine. No walk-up registration will be accepted. As more vaccine doses become available, more appointment slots and vaccination clinics will be opened. So moving on to our regular update, since January the 20th through January the 26th, we have 1,790 new cases of COVID-19 reported in Montgomery County. This is a daily average of 256 cases and brings us to a total of 41,656. All of these cases are a result of a positive test for the virus, not from the antibody test. In this week's cohort, we have 71 of which are from long-term care facilities, 3 from other congregate settings, and 1,716 from our community. These positive individuals were from all 62 municipalities in Montgomery County. This group ranges in age from 3 months old to 99 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographic and municipal information. Today, we had 929 females, 859 males, and 2 unknown. I am very sorry to confirm that 26 additional Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 1,125 deaths confirmed positive from COVID-19. These 26 individuals ranged in age from 61 to 94 years old. 20 died in a hospital, 1 in a long-term care facility, 1 in a residence, and 4 are unknown. Overall, since the pandemic started, 584 females and 541 males have lost their lives to COVID-19 in Montgomery County. They ranged in age from 25 years old to 106 years old. In terms of racial breakdown of this group, we report self-reported race or family-reported race when we have it. We have 2 individuals that identified as American Indian or Alaska Native. 30 Asian, 6 Asian Indian, 5 Asian Korean, 135 African American or Black, 554 white, and 393 unknown. There are no new updates from the Montgomery County Correctional Facility. The situation there is stable. And I do want to remind everyone that we are now conducting routine antigen testing for all correctional officers. So let's take a look at our positivity rate. Our positivity rate has continued a downward trend. Actually, you know what? Let me just back up here 1 second. Yep, I'm good. I'm sorry about that. Our positivity rate has continued a downward trend this week. Our 14-day average positivity rate is 8.53% as of Thursday, January the 21st, compared with 9.5% as of Friday, January the 15th. So this is great news. It's nice to see that line bending down. As a reminder, the orange squiggly line are the number of tests that were conducted on Montgomery County residents on that particular date. And then the blue line is our 14-day PCR positivity rate. So nice to see that coming down. As a reminder, our goal is to get back down below 5%. That is considered suppression of the virus. And then this graph shows the daily positivity rates from January 8th to January 21st. That red line represents that 5% bar. So we are a tiny bit closer than we were a week or two ago for sure, but we still have a ways to go. In terms of our hospitals, our hospitalizations are also on the decline, which is good news. Today, 289 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 324 last week. 10% or 29 of these individuals are requiring a ventilator. Our hospitals do remain quite busy though, so it's great that these numbers are down. It's given them some breathing room, but please don't think that this is by any means over. To put this in some context, on October the 1st, there were 24 patients hospitalized with COVID-19 in a Montgomery County hospital. And as a reminder, we have this information posted daily on our Data Hub website at montco.org/COVID-19. So we continue to have plenty of testing available. For the 14-day period ending January the 15th, 54,008 Montgomery County residents were tested, which is a decrease of 4,776 people tested compared with the 14-day period ending January the 15th. And we'll take a look at what's happening. This is another graph that is certainly moving in the right direction. As a reminder, the gray bars are the number of positive cases on any given day. The red is the 7-day average of all the cases, the community, the long-term care facilities, and any congregate cases. And the pink is the 14-day average of those total cases. The dark blue is a 7-day average of all of the community cases. The light blue is the 14-day average of all these, just the community cases. So it takes out the long-term care and other congregate facilities. And then way down at the bottom, the orange and yellow are the 7-day and 14-day average for the long-term care facilities. So let's take a look at this last 10 weeks, and you can really get a sense that we appear to be clearly over that holiday surge. You know, we've been talking about this now for a number of weeks. We hit Halloween, got a rise. We hit Thanksgiving, a big rise, started to wend its way back down. We got a little bit of a jump after Christmas, another little bit of a jump after New Year's, but nothing like what we saw at Thanksgiving. And now, thankfully, we are steadily on a downward trend with both our 7 and 14-day averages moving downward. We continue to have good availability of testing, and as always, I want to urge anyone who wants or needs to be tested to get tested. This is the best thing that you can do, and it gives us the best information possible so we know what's going on in our community, and you can stay safe and keep your family safe. Our testing sites are open Monday through Friday with varying hours each day. This Saturday, January the 30th, the Ardmore site will be open from 9 a.m. to 1 p.m. Registration for this site will be online only, starting at 7 p.m. on Friday, January the 29th at montcopa.org/COVID-19. And at the top of that page, click on the County Testing Information button. Also, you can register by phone Monday through Friday, starting at 8:30 a.m. at 610-970-2937. That is phone registration. That is Monday through Friday, beginning at 8:30 a.m. We do have language line available. Monday through Friday, the online registration opens the day of testing at 7 a.m. for that day. As a reminder, you cannot book tests ahead. You have to book the day of. So just a final reminder that we do remain in a very serious and continuously evolving situation. While our cases are trending down, which is fantastic news, we averaged 256 cases each day during the last week, and we lost 26 lives. So folks, we are not done yet. We have a long way to go here. So while we await the arrival of enough vaccine in our community to vaccinate everyone who would like to be vaccinated, we must think about those 3 W's: wear our masks, wash our hands, and watch our distance. And with that, I'll turn over to Commissioner Ken Lawrence.
Good afternoon. Thank you, Val. I'm going to give a report today on the Montco Strong Restaurant Grant Program. Today, we're announcing that the Redevelopment Authority of Montgomery County has approved 194 restaurant grants for a total of $1.94 million. They have begun notifying grant awardees yesterday morning. Just to remind you, applications for the grants went live on December 30th and closed on January 8th. Grants of $10,000 are being awarded to each qualifying business. And this is the initial allocation of a total of $6 million in county economic development funds that the Board of Commissioners has approved to support restaurants and other food service businesses that have suffered financially due to the COVID-19 pandemic. Last year, Montgomery County awarded nearly $20 million to help small businesses and nonprofits struggling due to the impacts of COVID-19. We know that our restaurants and other food services businesses were particularly hit hard during the holiday season with additional mitigation measures and are struggling to stay open right now with limited and sometimes no in-person dining. Montgomery County's restaurant industry is a cornerstone of our economic and workforce development, as well as central to the growth of entrepreneurship, job opportunities, and our communities. So just a little background, eligible grant applicants must have been a for-profit restaurant, food truck, deli, bakery, brewery, distillery, vineyard, caterer, or other food services for-profit entity with a physical location in Montgomery County. They must have been in operation since at least January 1st, 2020, and experienced disruption due to the COVID-19 global pandemic, while also meeting criteria that was listed on the application site. Any applicants that were ordered closed for any public health violation by the Montgomery County Office of Public Health, including any issues related to the spread of COVID-19, or who have willfully violated lawful COVID-19 mitigation orders issued by the Commonwealth of Pennsylvania since January 1st, 2020, were not permitted to apply. And here's a summary of the demographic data on the applicants. 886 applications were received during the application window. 58 of Montgomery County, 62 municipalities were represented. 35% of the applicants identified as minority owned. 33% of applicants identified as women owned. 4% of applicants identified as veteran owned. 27% of applicants indicated they had received a Montco Strong grant in 2020. And 73% of the applicants indicated they received a PPP loan from the U.S. Small Business Administration in 2020. So we have up to $4 million, over $4 million, which remains to be awarded. And the demographic data for the 194 awardees that are approved through January 27th are 47 of our municipalities are represented. 33% are identified as minority owned, 39% identified as women owned, 8% identified as veteran owned. Eligible grant expenses include rent or mortgage payments for a business location, payments for utilities for a business location, purchase of personal protective equipment, and payroll for non-owner employees and or their family members between the dates of January 1st and March 5th. A list of the currently approved grantees should be able to be found by the close of business today at www.montcopa.org/commerce. And this program was jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. And we would like to thank the staff of the Redevelopment Authority and the board of the Redevelopment Authority for their assistance in this program. The RDA is meeting again this week to approve more grants, so we will be notifying people on a rolling basis moving forward. And that concludes my report, Val.
Great. Thank you, Ken. And with that, I'll remind everyone that our next virtual briefing will be Wednesday, February the 3rd at 1:30, and we would be happy to take questions.
Our first reporter will be Jim Melward from KYW.
A couple questions about what you just mentioned. First off, you mentioned an original amount the state told you to expect. What was that number?
7,500.
And did they give a reasoning for the 3,000 reduction?
No.
And you're also saying 18 to 64, not 16 to 64. Is there a reason for that?
Yes, we use the Moderna vaccine. The Moderna vaccine is approved down to age 18. The Pfizer vaccine is the only one right now that's approved down to age 16.
Understand a story in the Philadelphia Inquirer, that tip. And also from comments from the Pennsylvania Department of Health, Montgomery County Pharmacy got a lower allotment of vaccine because of an agreement that they'd made with a Philadelphia private school. I understand that's not the only private school that may have been working on deals with pharmacies. Was the county in any way involved in any of these discussions or stepping in to stop any of these deals?
So let me first explain how the allocation of vaccine is done. The Pennsylvania Department of Health is making the decisions about who gets vaccine. And several months ago, doctors' offices and pharmacies and hospitals and the counties all had the opportunity to apply to be vaccine providers. So the Pennsylvania Department of Health decided who was eligible and made the approvals for those particular providers. Then once the state gets its allocation of vaccine, they divide it up. And it is under the PA-DOH's purview where those particular doses go. So the county is not involved in those decisions, and we don't have any control over where PA-DOH is sending those doses. The only involvement, and I'm not even sure how consistent this has been, if we've even been asked, is we've been asked whether or not various entities, not just schools, could move into the 1B category, and we have consistently said no. We have reiterated what PA-DOH guidelines are, which right now is entirely still this 1A group.
Well, I guess first off, the way the system is, where there's not a centralized Department of Health in each county and each region that's kind of in charge of distributing, are you concerned that this system breeds deals like that or side deals with pharmacies, whether it's financial, whether it's agreements for other things? Doesn't this system kind of create a situation for that to happen?
My concern is that we are in a very serious situation as we try to get ahead of this virus, and especially now that we know with certainty that this more contagious virus variant is in our midst. So my goal is a simple one. I want to get as many shots into as many arms here in Montgomery County as humanly possible. And with the infrastructure that we have in our Montgomery County Office of Public Health, the best way to do that is to give our Office of Public Health as much vaccine as possible, along with our hospital partners who've done a fantastic job as well. I think a centralized distribution of vaccine to sites that can mass vaccinate is the quickest, most efficient way to get vaccine into the arms of Montgomery County residents. Now, there are counties that do not have health departments, and they do not have the infrastructure that we have here. So in those counties, I think it's very important to take that into consideration. And it will be absolutely necessary that different models are deployed in those counties because they don't have a health department to set up the kinds of infrastructure that we have. But in our county, the best, most efficient, most equitable way to get vaccine into people's arms is to give as much as possible to our Office of Public Health.
I don't want to put words in your mouth. The counterbalance to what you're saying then is doctors' offices or pharmacies. Therefore, you don't see them being the most efficient way to do this.
I think there will be a role for that in the future when we have more vaccine available. But right now, you've seen the numbers. We're nowhere near the amount of vaccine that we have demand for. So let's just take 1,000 doses. The Department of Health gives us 1,000 doses. We can give those 1,000 doses in one day. If they give those 1,000 doses to any other entity that's smaller and doesn't have our infrastructure, it might take them a week to give those 1,000 doses. That might be completely acceptable 4 or 5 months from now when we have more vaccine. But today, with as little vaccine as we have, and with the numbers of cases and deaths that we have, the best way to get vaccines into the arms of Montgomery County residents is to give that vaccine to the county and to our hospital partners who are set up to do large vaccination clinics.
Last week, you told us you expected it would be about a year before you would be able to get through the current 1A eligibility. Does that factor in these other outlets, hospitals, pharmacies, and doctors' offices? When you do that math, it looks like they're not factored in. Could that speed it up?
I think with our hospital partners, it could speed it up a bit, just because they have been, in many cases, giving, anywhere from 500 to 600 to 1,000 in some cases doses a day, depending on the hospital. So I think they can be extremely helpful, but I'm not seeing a great deal of high volume success with doses going to entities that just don't have the infrastructure. And it's not, disparaging of them. It's just very hard for a single doctor's office or a single pharmacy to vaccinate 1,000 people a day like we can.
And one last question. There's a lot of confusion. I even talked to a family member who lives in a different county. She said she signed up with Chester County and thought that took care of everything, that she didn't need to go to each individual pharmacy. What's your message to people who think that they have covered all their bases by signing up with Montgomery County?
Yeah, that's a great question. There is not a single centralized registration process for the distribution of the coronavirus vaccine. So whoever you've signed up with, for instance, if you sign up with Montgomery County, you signed up with Montgomery County Office of Public Health. You have not signed up with a pharmacy or individual doctor's office.
Thanks. I'm good.
Next, we'll go to Deanna Durante from NBC 10.
Following up on Jim's question then, are you suggesting that everybody sign up in as many places as they can in order to try and get that vaccine?
I think right now, given the way that vaccine is being distributed, I would suggest that, because I don't have control over where this vaccine goes. And I am making the case with PADOH that this county health department should be getting a lot more than we're getting because of our ability to deliver it efficiently and effectively. But until we start to see much greater doses, I think that people who really want to get vaccinated as quickly as possible should try to sign up in multiple sites if they can.
Yesterday, I was speaking with a local hospital, the chief nursing officer, and he told me that he's getting calls from people who went and got the first shot, and then because of this, the promised second doses, the backup doses, the releasing from the government, that he's hearing from people who are calling him saying, I got the first shot from this place, but now they don't have it for the second shot. Is the county hearing complaints like this or issues like this?
We are, but I would put a little addendum to what you said. The complaints that we're hearing are a little more specific in that the individual got their first dose at a place that was vaccinating people for first doses who were not eligible in the 1A category, and that they have then subsequently been told that they're not going to receive doses for that second dose. So, and then there was the whole issue in Philadelphia that's happened over the last couple days with the entity that they had been contracted with. It's not clear what's going to happen with the second doses for those individuals. So most of what I've been hearing has been that not that the second doses don't exist, it's that there's not a second dose because of the circumstances in which that individual got their first dose. I will say that so far, our Office of Public Health has received all expected second doses. So that's exceptionally good news. We're really pleased about that.
Okay, and to qualify as to why I didn't have that information is because they didn't want to violate any kind of HIPAA. But then doesn't that, sure. And I realize that we're probably making you say the same thing, but isn't that one more example then why this should be a centralized process and not handed out to, as one hospital official told me for the story I did yesterday, to every county or every, as he put it, fiefdom to make up their own rules? I mean, that seems scary if people were caught giving out vaccine where they shouldn't have been giving it out.
So as I've said, I feel strongly that in a county with a health department that has demonstrated that they have the infrastructure to efficiently, effectively distribute these vaccines following the guidelines, that's where the vaccine should go, where the vast majority of the vaccine should go. And we are such county.
I have some questions about schools. I asked you last week about push to get kids back in person. There were petitions going around. There's a lot of frustrated parents, but also now we're starting to see this week a number of school buildings, not districts, that are closing down for in-person learning based upon either high numbers or what's believed to be, in one case, possible transmission. What do you want to say to people out there that want to get their kids back into school? And what can you say about these instances where the health department has recommended building closures?
So I would say to families that the best thing that you can do to get your children into school and to keep them there is to make sure that your entire family is wearing a mask, washing their hands, and watching their distance. There's just no way around this. And that goes for any time that you are out of your home. And so we continue, we're right back where we were, like a broken record in the fall. We're seeing small private gatherings with students and families. We're seeing people carpooling without masks on. We're seeing transmission on the sports, on the playing fields, at practices, because people aren't wearing masks. I mean, we could take a press briefing from the fall and just run it again. So there's no mystery or surprise here. If parents want their kids in school and they want their schools to stay open, they have to adhere to these guidelines. There's just no way around it. If they don't, we see spread. And so the schools that have had to close buildings, we are just continuing to work with them very, very closely. We have, every school district has a pandemic liaison, and that pandemic liaison has a direct liaison in our Office of Public Health. They work hand in glove together, and they know what all the guidelines and rules are now from the Pennsylvania Department of Education and Department of Health, and we are working with the schools and following those guidelines.
We're starting to see travel season pop up. What about people who do travel for spring break and things like that? I would imagine the guidelines are still the same for when you go and when you return.
Yes, I don't believe that those guidelines have been changed. And of course, all of that holds true for wherever you travel to and come back here. You need to be tested. You need to be quarantined until you're certain that you're not bringing virus from another location back to Pennsylvania.
there's a lot more places, pop-up places that are offering rapid tests. Are people relying too much on those tests? I just got back from a trip. I tested negative, so I can go here, I can go there. I don't know what your contact tracers are finding, and even if they're even getting that detailed right now.
Well, first of all, the contact tracers are not getting that detailed because still with, averaging 260, I think, or 50, 60 cases a day, we're still doing the prioritized contact tracing, which focuses on supporting our schools, doing contact tracing for people over 65, and any kind of workplace outbreaks. So the rapid testing, if it is antigen testing, it is not as reliable as that PCR testing or the rapid PCR testing. So people should be asking which test they're getting. And just continuing to be cautious, particularly if they believe that they've been exposed. So again, so much of this is about personal behavior and how people are conducting themselves in their communities. And we just need everybody to be careful, especially since now we know with certainty that this more contagious variant is here in Montgomery County.
Back to the issue we brought up in the beginning, the second dose issue. So those places where people got the vaccine that weren't supposed to get the vaccine, what do you do with them now? Do you go ahead and vaccinate them? Otherwise that first shot's wasted, or do they go through that whole process again?
Yeah, I think there's attempts being made to work that out. I know that particularly in Philadelphia, they are working on a plan to vaccinate with the second dose the individuals that were vaccinated by the group that is no longer working with the city. There was a drugstore chain also in Philadelphia that did a lot of early vaccinations, including some Montgomery County residents that were not eligible at that particular time. And I believe that that chain drugstore has been told that they can go ahead and give those second doses. So there is some acknowledgement of that, we do need to vaccinate those people. I've had people who are in Florida, who are Montgomery County residents, say that they got their first dose in Florida and they want to know if they'll be able to get their second dose if they come back here. And we've told them no. We can't guarantee any second doses for people like that.
Thank you.
Next, we'll go to Yubing Hong from ChineseandUS.org.
I just wonder if someone they sign up the website, but they don't have the feedback. If they sign again, about that.
So I'm sorry, you're wondering if someone signs up in our website and they don't have, I missed that, don't have what?
Don't have the feedback, don't have like a submission, the information. They don't know whether they successful to set up. So
okay. So yes, so great question. So when someone signs up on the Montgomery County website, they should immediately, once they've hit submit, within a minute, they should receive an email from Montgomery County saying that their registration, their pre-registration has been received. So we urge people to check their spam folders, to keep a lookout for that. It should come right away. And if they don't receive that email, maybe it means that they had a typo in their email address. But otherwise, make sure they're checking their spam folder. And if they don't receive a confirmation email, then they can try to sign up again. If they're stopped because there's a name match, there is an email on our website where people can email to see if their registration went through. But I do ask people to be patient. A lot of people are emailing with questions about the vaccine process, but we will eventually get back to them.
Okay.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. Couple questions on the variant. As a doctor, Dr. Arkush, how concerning is it that it has now appeared in Montgomery County? And what is the latest medical information regarding its contagiousness and how deadly is it? Is it deadlier than the original virus? What do you know about that so far?
So the story around the UK variant is continuing to evolve. The scientific community seems pretty much in agreement that it is about 1.5 times more contagious than the regular variant. There is some very early data that, as far as I know, has not yet been confirmed out of the UK that suggests that it may be more deadly, but I think it's too soon to say that. I haven't seen anything with certainty around that, just a suggestion that that might be the case. But there is agreement that it is more contagious. And so it just underscores the importance of wearing masks and keeping that social distance, in particular, avoiding indoor gatherings where people are taking their masks off, that sort of thing, because it is definitely more contagious. As far as we know, the vaccines that we have here in this country against the UK variant seem to be effective, but that is being closely watched. There's another variant out of South Africa, very similar to one that's also in Brazil, where there's some question about the Moderna vaccine and some sense that it may not be quite as effective, but still effective. So I do not want people to panic. Getting these vaccines will be extremely important in getting ahead of these variants.
Okay, and the bartender who was diagnosed with the variant, did that person have to be, was that person hospitalized? You know?
I do not believe so. I was not given that piece of information in the report that I got from the health department. We can certainly get a confirmed answer to that question for you.
And how concerning is it that, being that this person was a bartender, and how concerning is it that there may have been patrons in that establishment that may not know that they had contact with?
Well, again, it's just a reminder of how important these mitigation protocols are. So if a restaurant was doing everything that they should be doing and people were maintaining social distance and the staff person, this individual, kept a mask on at all times and kept at least 6 feet away from any patrons, I think the risk is small, but you know, if those mitigation measures weren't strictly followed, then the risk is definitely not zero. And even if they were strictly followed, you know, there's always some risk. These mitigation measures are not 100%, but they're critical in reducing the risk of spread.
Okay, thank you. That's all I had today.
Thank you.
Next, we'll go to Tony Wood from the Philadelphia Inquirer.
Tony, I see your lips moving, but I can't hear you.
Can you hear me now?
Yes, now I can.
Okay. Sorry about that. First of all, thank you for waiting for me. As I told Todd, I need to get back to the century. My question regards the situation with the UK variant diagnosis. You mentioned that there were other patrons or employees at the bar who tested positive for COVID. Do you know how many, and were there, do you know how many employees versus customers were tested positive?
So just to clarify, this was a report that I got from our contact tracing team through the Office of Public Health. I do not believe that they noted that any patrons had been positive. The comment about other staff was that this dated back to November, that there had been COVID cases in this particular establishment reported over time since last November.
Okay, thank you. Next time I'll log on right away, by the way. So.
Great. Happy to have you.
Next, we'll go to Kelly Cofrancisco with some questions from 6ABC.
Sure. Maggie Kent at 6ABC submitted 2 questions. So the first question is, how will President Biden's new announcement of purchasing 200 million vaccine doses affect Montco? If there is an influx of vaccine doses, is the infrastructure ready to distribute, and are there any plans for expansion?
So I'm very encouraged to see the Biden administration, having been in office only 1 week, start to take very aggressive and coordinated action to fighting this pandemic. This has been missing the entire time, this coordinated federal action. So it gives me great hope to see this happening. So the increase in doses is welcome news. My understanding is that those doses probably won't be available until late spring or early summer. But as soon as we can get any portion of those doses, we are more than ready to start giving that vaccine. So we welcome them and we hope they get here as quickly as possible. Another thing that the Biden administration announced yesterday was that, or the other day, was that they're going to try to give us all 3 weeks notice in terms of how many doses we'll be receiving. And that will be very, very helpful for us in our planning. If we knew with certainty that we were going to receive doses 2-3 weeks out, we could start releasing appointments 2 and 3 weeks out so that individuals would know sooner that they had an appointment and they could plan around that.
Thank you. Maggie's second question is, they received a tip that staff and parents at Germantown Academy are receiving vaccines today. Is there any truth to this? And are these vaccines appropriate based on the CDC guidelines and parameters of 1A and B categories?
So I have heard this rumor as well. I cannot confirm the rumor. As I mentioned earlier, the Montgomery County Office of Public Health does not give vaccines directly to schools or to pharmacies. And I have no idea where that vaccine might have come from, if indeed this is an accurate rumor. I would point out that we are still in the 1A category. We are not in 1B. And so the people that are eligible in 1A are healthcare providers or workers. So for instance, school nurses are eligible. We have vaccinated pretty much all the school nurses here in Montgomery County. Anyone 65 years of age or older, if they are on staff anywhere, they're still eligible just by virtue of their age. And those that are 65 and under, if they have one of a list of about 10 or 11 specific conditions. So that's who's eligible right now. Here in Montgomery County, nobody who is in the 1B category just by virtue of their job. So for instance, a healthy teacher who is under 65, that person is not eligible under the current guidelines, nor is anyone's family member eligible by default unless they fit one of those age or pre-existing condition categories.
Thank you. That concludes our submitted questions.
We have a few reporters on the line with follow-up questions. We'll start with Jim Melward from KYW.
Yeah, just really quick, going back to the question that Deanna was asking about the second shot. Are there any, you mentioned Montgomery County residents who went to Philadelphia. Are there any that you know of Montgomery County facilities that may not be getting the second shot or second dose?
Not that I'm aware of, but I wouldn't necessarily know that just because, as I mentioned earlier, we don't have eyes on that process. That is entirely from PADOH.
Thank you.
Thanks.
Next, we'll go to Deanna Durante from NBC 10.
I just want to clarify, and I know because of privacy, there's probably not a lot you can say, but I'm going to try and ask this anyway. The bartender, the restaurant, and you said that there have been COVID cases reported over time since last November. You mean with employees at that establishment, or that back in last November, contact tracers linked patrons there?
We could get you confirmation on that, but I believe it was employees.
Okay. Thank you.
Yep.
That concludes our questions for today.
Okay, great. Thank you, everybody. See you next Wednesday at 1:30.